a session here in foam rolling today. Some recent systematic review showed evidence that foam rolling is effective in reducing delayed onset muscle soreness, the DOMS. You might get that following a heavy gym session or a heavy or hard run or some new exercise, so that muscle soreness you get. The rolling will help that. It also showed that the rolling is effective for increasing range of movement at a joint. So we'll demonstrate some of the techniques that you might use for that. What we're also showing today is we have this sports performance pack, which is basically your independent DIY mobility and core conditioning type of kit. Helps with maintenance of tissue function and like flexibility around the joint, and say your quads, your glutes, or whatever, your calves, and also activates your core by doing like certain core exercises, which I'll demonstrate with the bands and stuff later on. Fundamentally anyway, our main tool for foam rolling is a roller device like this one, or the blue one standing up here. But these ones with the kind of knobbly bits are quite useful because it helps loosen up the myofascial tissue or the muscle and the surrounding connective tissue a bit more easily. The principle is you're just mashing the muscle and loosening it up, alright? So the idea will be here, we'll demonstrate the calf, for example, is you just get your body weight, you can roll on the calf and up and down along it, turn to the inside part of the calf and roll up and down along it. As you can see, my body weight isn't all down through that part at the moment. What you can do is you can just put more weight down through the calf and get a firmer pressure down through. Is that alright? So that'll help release it up and loosen up quite a bit. Focus into the tender points, and you might do a movement which is like a pin and stretch, where pinning on the sore point and stretching through actively with the shin muscle here, okay? And the whole idea here, and with every other muscle, would be to break it down into sections. So you might do the upper section here, work through that, and then midsection and lower section. And then likewise turn on the inside and work up along the inside half of the calf. Is that fair enough? So that would be the idea with that. And you can complement it with some active isolated stretching, then just pulling up towards, activating the shin muscle and pulling in. Is that alright? So that's just some low level active isolated stretching. Hold for 2 seconds into the stretch and let go. And repeat 10 times with a 2-second pull into the stretch position. Is that alright? And that principle would apply for all muscles that you work on. You release it with the rolling and you stretch it thereafter then with some sort of a stretch technique that is of in favour. We'll identify a couple today. So then from the shin, you might go onto the front of the shin and you can work through here. I'll just give you a brief idea. You might work up onto the quad, right? Up along the front of the quad, so it's quite a big muscle. And you go onto the lateral quad on the outside, okay, or IT band along the outside as well. Up onto the hip, so your TFL in the front of the hip, like that. Okay, just demonstrate it this way as well. So just in here on the TFL, just up here on the side of the hip. That all connects onto your IT band down to the outside of your knee. So if you suffer from like runner's knee or pain in the or IT band syndrome, that would be effective for loosening off that whole sling down along that side. Is that alright? You might get into the groin then as well. So along the adductor and the inside here, and just onto the roller and working up and down along the groin like that. You just kind of have to position your body that you're getting a downward pressure down that way, so it's getting the muscle to press against the femur, the thigh bone. Is that alright? So you're just getting a decent pressure through it like that. Okay? So that's kind of fundamentally the rolling technique. You can bring that up onto the lats and to the mid-back as well. So I'll just demonstrate a few of those as well, just for completeness. Okay? So you might get onto the lats here, into that side, kind of a side bending position here. You're working up and down, quite tender, and work away that way. Is that fair enough? You might want to mobilize your lower back or your mid back, so just be careful with this one. If you're not familiar with it and comfortable with it, don't do it. You can give us a shout and we can instruct you and guide you as well. And as I said, we do group sessions for this as well, just to educate people how to do it correctly and safely. So the main thing is you're kind of just doing a lean back over this way to free up that mid back section. Okay, up and down like that. So that's just extension mobilizations for your mid-spine, you know. can do the same, lower down, side to side, in your QL, your lower back. Alright, getting in there, side to side. And again, spending a bit of time, not just as short as what I'm doing here, you spend like 30 seconds to a minute working in there. Is that alright? So that's some of the ideas with the roller. Then what you can do also, you can use a hockey ball, right? Or a cross ball in this bag, and you can get deeper into tissue because it's pushing more into one kind of specific spot. And again, that will be quite strong as a treatment option to soften up those trigger points out of the muscle. Is that alright? And you can apply that for any muscle again. It's particularly useful for, we'll say, the glutes, because the roller doesn't really get into the strong glute tissue effectively. So you're going to go, there's the top of the hip, there's the bone of the outside hip, and then you're just going to roll onto that, okay, and just get that pressure down through it here. So you've got a nice solid pressure down through the glute, outside hip muscles, and that can send pain around the hip into your backside area or down into the back of your hammy. And so don't be alarmed by that, just sit on it, wait for it to relax. That's just a referred pain from the muscle that's a bit tight. Is that fair enough? So for the example, I've done like a minute or two on my glute, then I come off into a kind of a pigeon type of yoga stretch, which is just like this, trying to lower my right hip, keep my pelvis level and slide back. So I'll just demonstrate that to the side, where you're like that, and you're leaning back and you're getting that low level stretch through the glute here into that position. You can twist your upper body a bit to get more stretch through that glute and lower back here. Is that fair enough? Equally then, you can do that in the QL in your lower back, kind of like what I demonstrated on the roller. You can do it into the back of the shoulder, onto the rotator cuff. Okay, so that goes in here, into the back of the rotator cuff here, which is quite problematic in people who like boxers or people who play a lot of racket sports and that kind of thing, swimmers. So it's just handy to free that up and around here. Again, that can send pain like quite all over the shoulder. If the shoulder is sore doing overhead presses, give this a blast for a minute or so to loosen up the rotator cuff at the back, okay? As you see, I'm moving around and I'm finding the spot and holding on it. And all your holds should be about 30 to 40 seconds to allow that painful or that sore point to fizzle out, alright? Then I might follow that up with like a sleeper stretch, which is like this, cranking down, hold for a couple of seconds, or a cross body stretch like this to stretch out the back of the shoulder. Is that alright? And repeating a set of 10 with a 2-second hold into those movements. So that's our kind of fundamental soft tissue work for around that area. Very useful, and you know, that'll help free you up, okay? We would be advising you to do this regularly before sport, but again, according to the science, it won't activate or prime your muscles for that sporting activity. It'll just loosen you up. You still will have to go on and do a dynamic warm-up then, and you see the link on our post regarding an example of what we consider a decent dynamic warm-up. So that's the first phase of it there for the moment. I'll continue with phase 2 there in a second, so catch you for that. Thanks.